There's a huge battle at the moment for public trust when it comes to medical advice and decisions, certainly in the United States. And we're seeing it played out in real terms between the Attorney General and the Texas Medical Association. This is an interesting article that I've seen where the Attorney General is accusing the Texas Medical Association of undermining new COVID vaccine guidance. Now, my problem in this situation is very simple. During the pandemic, when we had very strong mandates coming from many sections of the medical fraternity, and there was almost a complete silence about any alternative strategies, including things like vitamin D. I honestly don't think that is acceptable science. And what we're facing now is the reality, and many organizations need to reflect carefully on this, that if they continue to appear as though they are more aligned to agendas and industry, they are going to lose the public. But the lines are very clearly drawn and they seem to be quite political. And in terms of this presentation here, you will see what I mean as to why the politics is coming up. For doctors, we need to be very careful. We just need to avoid the politics and remember that the fundamental duty is patient advocacy, not system advocacy, not government advocacy, not association advocacy, patient advocacy. So here is what this is about. And this is the article from Texas Scorecard. And what happened here is that Attorney General Ken Paxton was criticizing the Texas Medical Association for rejecting the recent federal advisory guidance that emphasizes patient and parent choice in pediatric COVID-19 vaccination decisions. So it's not that the CDC went and said you can't vaccinate children. They just said that you need to have a discussion with regards to the parent about what is going on. And let's so that we are very clear as to what happened. This was the release from the 19th of September, 2025, from the HSS press office. And here we have the ACIP recommending COVID-19 immunization based on individual decision making. Okay. And what they were saying, it applies to all individuals 6 months and older. It emphasizes that the risk benefit of vaccination in individuals under the age of 65 is most favorable for those who are at increased risk of severe COVID. So they didn't take the vaccine off the market. They just highlighted the point that this now needs to be between the clinician and the patient based on their risk. This is what it always was. I don't know why politics and finance got involved in this. And it was a failure of, in my view, a failure of the system that more questions weren't being asked when mandates were instituted. Because the duty is to advocate for people for whatever reason. If they didn't want to have a vaccine and if they were at low risk or even if they were at higher risk, it's about discussing and coming up with the best plan. So this argument is between two people essentially. The first one is actually the Attorney General in Texas. And this person here, and I'll show you this here so you can see where it's coming from. This is Ken Paxton, the Attorney General of Texas. He has been in position since November 4th, 2014, and he represents the top law enforcement officer for the state. And he's been around for a while. And what you have to know in terms of the background is that from a political point of view, he was against COVID vaccine mandates, which therefore put him against the Biden government at the time in the US challenging the COVID vaccine mandates. On the other side is the Texas Medical Association. And what you have to realize is that this Texas Medical Association is looking out for the physicians under its link, meaning that they represent advocacy for doctors. Now, the natural association is that if you're advocating for doctors, you're also advocating for patients. I'm sorry to tell you this, but this doesn't necessarily mean the same thing. The truth is that defensive medicine, which is becoming much more prevalent in terms of situations where people can be sued, is primarily there to protect the doctors from patients who would take advantage of situations. But the problem with defensive medicine is that very often the patient is not at the front. It's not quite the same as patient advocacy. And when we look at this organization, it is the physician's advocate. Okay. And so when you think about that, you have to then reflect very carefully on why they would take this stance at this point. This is what really got me thinking. I understand that there is a battle in the United States between, say, RFK and his position with HSS, and the fact that many people believe that he shouldn't be in that position, so they're not going to listen to him. It's that kind of argument going on in the background. And in the middle are real patients that can be affected or impacted by the decisions that are being made. So when I thought about this, I asked myself the question, well, whilst they are arguing about what is going on, and so let's just actually see exactly what happened. Remember, I told you that they were no longer recommending vaccination. They were saying it was an individual decision. But what the TMA did is that they got in the middle of this and they shared with their physicians. Examples of supported vaccine recommendations include, but are not limited to, physician professional organizations such as the American Academy of Pediatrics, American Academy of Obstetricians, physicians, family physicians, and the CDC Advisory Committee. What they were saying is that there were many other organizations, when based on peer-reviewed scientific evidence, they recommended vaccines. So in effect, they were going against, in some sense, they were going against the recommendation by HSS to say that this is an individual decision. So my question is, okay, this is a US issue, isn't it? This is not a global issue. And how I came to that conclusion was based on the fact that I went to the WHO. Now, I do have some issues with the WHO, so it's not as if they're perfect. However, they represent a global voice, whether or not people want to agree. And so here is their recommendation with regards to COVID-19 vaccines and vaccine safety. And as I scroll down, who should be vaccinated? Can children and adolescents get vaccinated against COVID-19? Because this is specifically where the argument is between the Texas Medical Association and the CDC. Healthy children and adolescents, 6 months to 17 years, belong in the low priority group for COVID-19 vaccination. So they're not saying they can't have them. However, vaccinating them post-pandemic has limited public health impact. Now, people may say, well, what is there to lose? Because the vaccines are safe, they are effective, there is nothing to lose. Well, if you have been following along for some time, you will realize that there are many holes in that narrative. And one of the problems is that when it comes to children, and I was right at the forefront of that discussion when I spoke to Dr. Ross Jones, who is a pediatrician in 2022, and she was absolutely fuming that they were going to vaccinate children at that time because nobody had planned for it. And she was making the point that there was not a good argument for risk benefit. And when it comes to vaccines, as we learn from the swine flu vaccine and the narcolepsy that occurred, sometimes some of these complications don't just occur within 28 days. They can come a year later. And we have a lot more learning to do with regards to longer term implications. That's probably as safely as I can say. And with that in mind, I would think that not just the WHO, but most first world countries are not forcing this on healthy children, but children with comorbidities. Why is the United States different? What in the world is going on in Texas to make them take a stance like this? Because they are recommending that their doctors, in effect, go against the recommendation from the CDC. I mean, why would they do that? For what good reason? Because if anything goes wrong, they personally will become liable because they can't even say that they were following necessarily the exact recommendations. Makes no sense. And so you then have to wonder, even if they thought about this, even if they discussed this privately, why would you take a stand like that at this point in such a political environment? Just encourage your doctors to have the risk-benefit analysis with each parent. That's as simple and as logical as it should be. But what seems to be happening is that there is an appearance that there is some kind of influence that could be pushing organizations to do this in primarily one country across the world. And it's the country that has the most impact with regards to industry lobbying. That can't be a coincidence. Here is the reality. I think medicine has shifted. And for those people who are trying to pull it back to where it was pre-pandemic, they are likely to get a rude surprise. Medicine has shifted. Patients have shifted. Patients' trust has shifted. It is no longer just doing what people say. They now expect a discussion. They expect that you will negotiate with them on what is in their interest. That's the reality of where we are. My final point on this still is, I wish there were more organizations that in the heat of the pandemic were willing to have even said as simply to the general public, even if you don't agree that vitamin D could be the benefit in COVID, it is in the interest of every person to check their levels and get their vitamin D at least in the normal range. Very few, if any, said that. And it indicates that when they are willing to make a stand, coincidentally, it is more aligned with industry than just general, simple strategies that can help patients in terms of their general health. I don't think that's acceptable. I don't accept it. And I hope other clinicians will remember this period of time in the pandemic. Don't forget, our responsibility is first patient advocacy. Everything else comes second to that. As a final reminder, please look in the description. Humming Heroes, one of the most important, simple things you can do in the pandemic. So I am telling you, start humming, learn the science, share it with others. There's a beautiful book. It's free for the black and white version, and you can buy it for someone. And it teaches even children to understand the importance of nitric oxide in the sinuses. We look forward to educating you further. Thank you all very much, and we'll keep talking.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.